Hi, I'm Dr. Jitesh Rajpurohit, thoracic surgeon and oncologist, and today I'll walk you through the lung cancer surgery options, what they mean, and how we approach them. So, how do we diagnose lung cancer? So, when a patient walks into our clinic, we don't just jump to the conclusion. We take a detailed history, evaluate the patient, and then prescribe a few tests. Test first to ascertain the diagnosis, second to confirm the diagnosis, and thirdly to stage the disease. So when the patient walks in, we prescribe CT scan, which is the basic test. In CT scan, we want to look at what is wrong with the lung, to stage locally whether the disease is localized to the lung or it has spread to the nearby nodes. Secondly, we prescribe a biopsy, which is to confirm. Now the biopsy can be performed by various techniques. Either it could be a bronchoscopic biopsy if the disease is medial and which is close to the airway. If the disease is peripherally, it is more accessible via a CT scan. We would prescribe a CT guided biopsy in this scenario. Thirdly, we want to stage the disease now. We want to look whether the disease has spread to the different parts of the body or not. In this scenario, we would prescribe a PET scan. PET scan is a head-to-toe, a full body scan in which we can diagnose the disease, whether it has spread to the different parts of the body or not, through which we would ascertain and assess whether after the surgery, either a lobectomy or a pneumectomy, whether you will be able to breathe properly or not. Depending upon the levels, we would plan for the surgery. So now coming to the staging. As we know, the lung cancers are stage 1 to 4. Stage 1, the disease is localized to the lung, part of the lung or the entire one side of the lung, and the disease has not spread to the nearby or regional nodes. In stage 2, the disease is there in the lungs and it has spread to the regional nodes as well. In stage 3, the disease is there in the regional nodes, but it has also spread to the non-regional nodes, like the contralateral side. That means the other side of the lung, the nodes are positive, or the nodes are gone to the neck. In this case, we assign the stage as 3. In stage 4, the disease has spread to the different parts of the body. It could be abdomen, it could be bones, depending upon the type of the cancer, subtype of the lung cancer. So once we have staged the disease, we talk about the treatment part. As we know, there are stage 1 to 4. Depending upon the stage of the disease, the treatment varies. So coming to the stage 1. In stage 1, the disease is localized to the lung. So here the treatment would be primary surgery. If the patient is fit for surgery, he undergoes a VATS or a robotic lobectomy or pneumonectomy depending upon the size of the tumor. So if the patient is unfit, in this scenario, we may send the patient for a CTRT. Even this has got a very good curative role. Coming to the stage 2. In stage 2, the disease is spread to the regional nodes. Now the surgery is going to be a little difficult. So in this scenario, we send the patient for a neoadjuvant chemotherapy or immunotherapy. Now the latest reports suggest that immunotherapy has got a very good response. So in these patients, we subject the patient to chemotherapy or immunotherapy before the surgery. Once this patient has received 3 or 4 cycles of chemotherapy, we plan for the surgery and we take up the patient for surgery. Depending upon the size, it may be a lobectomy or pneumonectomy. In stage 3, the disease has spread to the non-regional nodes. Similarly, like stage 2, here also we send the patient to neoadjuvant chemotherapy or immunotherapy to downstage the disease. So once the patient has responded well to the chemotherapy and immunotherapy, now we plan for the patient for surgical resection. Coming to the stage 4. So here the disease has already spread to the different parts of the body. So it is now the treatment would focus on improving the quality of life and improving the longevity of the patient. So now with the latest treatment therapies available like immunotherapy and chemotherapy, patients live on for years together, even in stage 4. Lung cancer has got a very advanced immunotherapy regimes and targeted therapy available depending upon the tumor mutations.